everyone. It's a pleasure to be here. Like Joanne said, my name is Zainab Shinkafi Bagudu. I have a health background. I'm a pediatrician, but I ventured into politics by association because my husband is the governor of one of the states in Nigeria. Nigeria is one of the largest countries, or is the largest country in Africa, and even the most populous black nation on earth. Our current population stands at about 230 million people. Now, when it comes to cancer control, we have on record from the 2020 Global Cancer Statistics a new diagnosis of 120,000 per annum. We know that this is grossly underestimated, and the burden of cancer as well as other non-communicable diseases is constantly on the increase. This you all know. But for a country that has many problems, financing is not always efficiently managed, as indeed programs. The political instability, there's a lot of insecurity and some difficult to navigate terrain. It's hard to deploy the solutions. Income's universal health finance coverage that gives us an opportunity to bring the women under an umbrella that can help to improve their care. I didn't mention things like awareness and low education, which we also know about. So in Kebbi State, we've been able to achieve a little bit more than other states, I think, because of the political will, the push, and the ability to partner with various organizations, both in government and out of government. And this is the answer for most African countries, and definitely for Nigeria. There is a narrative of government doing it on their own, but it has to be in partnership with the private sector, with civil society, and of course, global organizations. The health insurance in the state health insurance was started about 3 years ago, and only recently have formal sector deductions begun. One of the innovative ways that we have worked with it's called the Kebbi State Contributory Health Insurance Agency. We have been able to lobby and negotiate. It helps when you're the wife of the governor interested in cancer, I admit, to have 5% of the formal sector deductions to cancer control. We started a cancer control plan in 2020, and this is coming to the end of the first 3 years this year. And funding it is going to be a problem if we don't have a sustained inflow of funds. It covers things that I spoke about: awareness, diagnosis, treatment, palliative care. So with that inflow of funding, we have been able to secure something that will go towards the spectrum of cancer care. Now, in the past, we've also reached out to government, of course, and other high net worth individuals within the state to set up an indigent cancer fund, which has been greatly beneficial. As a country, Nigeria also has a cancer health fund that is currently ongoing, which the federal government commits funds to every year, and is managed by a committee that I also sit on, and goes to the 7 pioneer teaching hospitals covering 4 cancers now: breast, prostate, cervical, and of late we were able to add childhood cancers. So I guess the lesson is just about partnerships, about speaking out and telling the story as it needs to be told. In Africa, we say if a tree falls in the forest and nobody hears about it, did it really fall? So we need to tell our stories, we need to tell our strong stories, and this is what I try to do. It's by no means the final solution, or we're not at the end of it yet, but we're starting and we're getting somewhere. So with partners, philanthropists, global partners, pharmaceuticals in particular, we've done a lot of work with Roche. We've been able to achieve something. And so my message would be, let's keep up the sustainable financing. Let's keep up the partnerships so that we can improve the cancers that are affecting our women. Thank you very much.